Should we dive in?
Okay.
Right, so first question, why might you be prescribed antidepressants?
Well, if you've been going through a prolonged period of low mood, possible anxiety, and losing interest in daily activities, then that's probably the time to reach out for some professional help.
Yes.
Sometimes family can sort of encourage you to visit the GP, because sometimes it's very daunting to have that initial chat with someone, especially about your mental health.
Yeah. And I find that usually a big concern is that if it's especially an activity that you used to enjoy previously, you once enjoyed but no longer.
Yeah.
I think that's usually a cue as to the fact that you might be feeling under the weather.
But if it's continuous over a number of days and months, even years, sometimes, so it's important to reach out for the professional help.
Absolutely.
Next question. Yeah.
So antidepressants are prescribed to balance certain neurotransmitters in the brain, which are responsible for emotions and regulation of mood. The two main ones are serotonin and epinephrine. And the aim is to restore balance and get back to your usual self.
That's why I always think medication helps alongside additional therapy.
Absolutely. I have to agree with you there, because it's not usually just the chemical imbalance. It's often a requirement to have a chat with people and talk through your feelings and rationalize how you're feling. And I feel like that in combination with medicines to regain that balance is important as an overall holistic approach.
I think it's for, just mental well-being, your physical well-being as well. So, nutrition, eating the right foods, exercise if you're able to, that helps. Regulate your body and your feel-good hormones. So it's just in combination with everything, and it can sort of help you get into a better version of yourself. Because with medication, it sort of helps with the symptoms, but the underlying cause could be still there. So that's why it's really important to speak to, if you can't speak to your friends and family because you're not comfortable speaking to them about it, it's more about professional help. The most common ones are, they're called SSRIs, citalopram, sertraline.
Fluoxetine is another commonly prescribed one, isn't it?
Fluoxetine, So
they're commonly prescribed, aren't they, because of their good safety profile, and generally they are known to be more well tolerated. There are other types of antidepressants which are perhaps less commonly, or if you might say they're not as first line, abbreviated as MAOIs, which stands for monoamine oxidase inhibitors. And these are less commonly prescribed, but sometimes can be prescribed as alternatives. Depends
on if it is more than just depression. So if it goes more into mental health, anxiety, mental health disorders, then they may consider it. But I think that's more of a mental health specialist that will look into that and decide if that's suitable for the person. Ask the questions. I think that's really important. Is if you get 10 minutes to speak to a GP, just go in there prepped with questions that you want to ask, because sometimes you're in the appointment and you forget what to say, and then you're like, I should have asked the doctor that, and then it's like you need to book another appointment. So just go in with questions that you have, and then I'm sure they'll be addressed by the doctor, and then you can work together to come up with a plan.